here today for a demonstration of Shockwave in a patient with knee pain. This patient has patellofemoral arthritis, so that's kneecap pain due to some degeneration and just a lot of activity, sports, very active in sports. So this is being offered as a part of an overall treatment plan that includes some injections of stem cells. Sometimes we'll use it in combination with platelets. And so we're going to use this device today. This is the focused Shockwave device. So what we're doing now is we're applying sound waves through the handpiece into the body. So at a level of 5, some people can feel it, some people can't. We want to try to get that magic number to about 20 and focus on the areas where we know the pathology is located from the MRI, but also focus in on where the patient feels the pain. But then go beyond that. They're getting the energy applied to their soft tissue. This is being applied to the bone, ligament, cartilage, muscle, tendon, all simultaneously. We measure the therapy in number of shocks. So every time you hear a little tick, that's a shock. We measure it in how fast the shocks are being applied, and then we also measure it in the amount of energy being applied. Most patients who are getting this understand, especially after they've had it for a while, that in order to achieve some meaningful relief and results from the procedure, we've got to get up to a certain level of energy applied, otherwise it's really not doing anything. So this is obviously a lot quicker, a lot easier than surgery. Very little downtime associated with this, so there's a lot of motivation for people to be able to use this as long as it's providing some meaningful results. So here we're going on to the patella, coming to the some of the lateral supporting ligaments of the patella, the distal quadricep tendon, vastus lateralis, patellar ligament, and making sure we're getting all of these structures treated at the same time. And this device can be used in both acute injuries and chronic injuries. Therapy is usually applied once a week, and in chronic conditions like arthritis, plantar fasciitis, tennis elbow, golfer's elbow, things of that nature, we're telling patients that they will typically require 4 to 6 treatments. At that 4 to 6 week interval, we don't expect the healing process to be completed. It's a process, a mechanical process that is triggering a biologic process inside the patient. So depending on the chronicity of symptoms and the severity of symptoms, the patient's going to need more or less. All right, we are done with our focused Shockwave. We're going to move on to Radial Shockwave. 2 different devices. One is not better than the other, they're just different. And this is going to be applied to some of the muscles that go into the knee. So pretty much your quad, your distal quad muscles, your IT band, and some of the ligaments down leading into the knee. And these are important because they're knee stabilizers. And we want that patella to be stabilized to the point where it rubs the way it's supposed to, and rubs the way it's designed to rub. So as we're doing this, we're really targeting all of the fibers in the quadricep, kind of front and side of the quadricep muscle, down the IT band to make sure that there's nothing really that we're missing as we're trying to get the healing process to take place. Okay, so we're done with therapy for today. Its process takes about 10 to 15 minutes each visit. Patients will sometimes feel better right away, and that's a nice outcome. Typically the pain's going to come back over the ensuing days, but then the processes will be repeated in about a week. There's no restrictions that patients have to take after getting the Shockwave therapy. They can return to activities that they were able to do before getting their treatments, and they can go back to that right away.